question. I think our patients might benefit from understanding the difference between liquid biopsy and a tissue biopsy. Can you just explain the difference? What are the positives and negatives of both, and how should we do molecular testing in our patients?
Yeah, I think that's a great question. Whenever possible, we try to get tissue biopsy, specifically at the time of disease progression. And I think it's not always feasible, just depending on how patients are feeling and doing and where the sites of disease are. So liquid biopsy offers a great alternative. Liquid biopsies are just basically a blood draw. They do assume that you have enough tumor burden, that you're, sort of shedding circulating tumor DNA in the bloodstream. And so when we don't get great results from liquid biopsies, it doesn't necessarily mean that you don't have a mutation. All it means is that we just weren't able to detect it in the blood. And in those cases, I would still try to do a tissue biopsy whenever possible. But what's nice is these liquid biopsies are available in the clinics. The turnaround time is quite fast, usually on the order of 3 to 4 days, and they can help inform some of our treatment decisions.
Yeah, and I can't stress enough your point that you make that, if you don't see things on a liquid biopsy, that does not mean that it's not there. Unfortunately, I have seen my fair share of patients where the only testing that was done on a patient is a liquid biopsy, and the liquid biopsy comes back negative, and the patient is being told you do not have a mutation. And then they come for second opinion, we test the tissue, and we find things, targetable things that we didn't see in a DNA, cell-free DNA or liquid biopsy, just because there is not enough DNA floating around. So basically, if you found it on a liquid, you're good to go. You can target it, because if it's in a blood, it's in a tumor. But if you did not find it in a liquid, just please advocate for your tumor to be tested, because you do not want to miss an NTRK mutation, because the drugs are so effective and so easy to tolerate. You just want to make sure that we are doing it.
Absolutely.